Good afternoon and welcome to today's Survey Methods webinar run by City St George's University of London, European Social Survey and National Centre for Social Research. I'm Rory Fitzgerald, Professor of Practice at City, and I'll be chairing today's seminar. I'm delighted today that we'll be focusing on the topic of measuring loneliness in the European Union. And I'd like to welcome our speaker for today, Matija Kovacic, from the European Commission Joint Research Centre. Matija holds a PhD in economics from Ca' Foscari University of Venice, publishes in many journals, and is a research economist and policy analyst at the Joint Research Centre of the European Commission. At the end of the presentation today, there'll be an opportunity to ask questions, so please put those in the Q&A function of the system. And without further ado, Matija, I'll hand over to you.
Thank you very much, Rory. I hope that you hear me well.
We do.
Good, thank you very much. So good afternoon to everyone, and I'm very happy to be here and to deliver this talk. I see that we are quite numerous, around 60. I'm very happy for that. First of all, I would like to thank everyone, the organizers, for giving me the opportunity to present our activities and research related to such an important topic, which calls for attention both of policymakers and researchers in general. So I'm Matija Kovacic. I'm working, as Rory said, at the Joint Research Centre of the European Commission, which is located in the northern part of Italy, not far away from Milan. And today I will talk about loneliness. Let me see. Okay, good. About loneliness and the main initiatives undertaken by the Joint Research Centre, where I work together in collaboration with the Directorate-General for Employment, Social Affairs and Inclusion since 2022. For monitoring loneliness in the European Union. So a brief outline of today's presentation is the following one. I will first give you a broad and the main definition of loneliness, and I will say a few words about different types of loneliness. Then I will start talking about how we measure loneliness in large-scale surveys, different measures that we usually apply, what are the advantages and disadvantages of these measures. Then I will present our survey that we designed at the Joint Research Centre, which is the first EU-wide survey on loneliness in Europe. So it covers 27 European member states. It focuses on loneliness. It is very specific in this regard, but it also contains several other modules, ranging from social media use, civic behavior, and so on and so forth. After I present the loneliness survey, I will give you some insights into the correlates of loneliness, the main one, and potential associations between loneliness and several outcomes, such as health, the individual's health and physical and mental health, social media use, and so on. And at the end, I will close today's presentation I will briefly address one of the main challenges that we have in the empirical analysis on loneliness, which is the problem of endogeneity and reverse causality, because loneliness, since it is collected from surveys, so it is self-elicited, it is an individual's feeling, so perception, and it is endogenous. And there is also the problem of reverse causality, because we don't know what influences what. I will not spend a lot of time on that, but I will just give you an example of how in one research at the JRC, how we dealt with the problem of endogeneity and reverse causality. But before starting to talk about our surveys and the way in which loneliness can be measured, I would like just to say a couple of words about my team. So we are a group of 6-7 people with very different backgrounds and very heterogeneous expertise. We have great economists, econometricians, sociologists, political scientists, and we all work in the Survey Methods and Analysis Center, which is one of the research groups of our unit at the JRC. And we are specialized in the research that supports high quality data collection and data analysis at the Joint Research Site, so at the Commission's level. And we provide the range of services for the European institutions to support, as I said, data collection, but also the design of questionnaires or the integration of the existing questionnaires and so on. Everything started with this project, which was a quite big project at the European level, that started in 2021, but that was not the first initiative undertaken by the JRC in the context of loneliness, because since 2018, the team was working on gathering data and providing evidence on loneliness and social isolation in Europe. But starting from 2021, in collaboration with the DG Employment, as I said before, and upon initiative of the European Parliament, we launched a new project to monitor loneliness in the European Union. And within this project, we delivered several outputs from different policy briefs, technical reports, academic articles, but one of the main deliverables of this project is the specific survey, a loneliness survey that we designed and collected data for 27 European countries. And now we are in mid-November, we will launch a book, Loneliness in the European Union. It will be published by Springer and launched to the European Parliament at mid-November, so in 1 month, more or less. As for the main phases of this project, the overall goal in general was to gather additional evidence to support decision-making on loneliness and social isolation at the European level. And the main activities were conducted in four separate phases, let's say. We first synthesize the existing knowledge on loneliness, the existing data sets, and the existing literature through the literature review and so on. Then we designed a survey, collected new data, which allowed us to perform additional analysis and to get additional insights into loneliness in several dimensions, as we will see in a minute. Our colleagues, some colleagues would also developed they were working on loneliness initiatives, so initiatives to reduce loneliness and to deal with loneliness in the European Union. And we have a repository of these initiatives, which is not exhaustive, but it is very informative. And we also then we launched our data set in a conference last year in Brussels, which was a high-level conference in which we also presented the main findings and results. Okay, so this was just briefly about the project, and let's start with loneliness, which is the main topic today, and I will give you the broad and the main definition of loneliness. So loneliness is defined as a negative feeling. So it is a subjective feeling that an individual perceives when his or her social relationships are deficient, or in terms of quantity or in terms of quality. So it is a very subjective phenomenon. And as such, it is quite complex as any other subjective phenomenon. What is important to keep in mind here is that loneliness does not mean being physically alone, because this is social isolation. Loneliness is feeling alone. So this is some kind of dissatisfaction with the existing social relationships. The other thing, another important aspect of loneliness is the quality and quantity of social relationships. So when we talk about loneliness, the literature generally suggests that quality is much more important than quantity, because quantity can also be a cultural thing. There are cultures or societies which are characterized overall by wider social networks, and these are usually, for instance, in Europe, countries in the southern part of Europe or southern eastern part of Europe, while other societies or countries or cultures are characterized by smaller social networks, like the Nordic countries. But this does not mean that smaller social networks are necessarily associated to higher probability of loneliness. And this is not the case, actually. So what counts more is the quality, the perception of quality of relationships independently how much of these relationships one individual has. Based on different types or different aspects of this specific feeling, loneliness can be classified into different types. One of the aspects is related to the duration of this feeling. So here we can distinguish between occasional or transient loneliness and chronic loneliness. So when we talk about occasional loneliness, this is also sometimes referred to as situational loneliness, right? And it is often triggered by some life events, like a loss of a partner, loss of a parent or a close family member, or even loss of a job, or moving from one town to another town. In the case of chronic loneliness, this is a persistent lack of good quality relationships in extended time periods. Then loneliness can also be very intense feeling. It can be also less intensive. And then another criteria, which is very important in classifying loneliness, is the type of relationships. So, and here we distinguish between two types of loneliness. We can have the emotional loneliness and social loneliness. And emotional loneliness usually refers to the lack of an intimate relationships, but while social loneliness is more linked to the absence of a broader social networks. And if we go back to the main definition of loneliness, then emotional loneliness is closer related then to quality of relationships, while social loneliness is related more to the quantity of social relationships. Then there are other types of loneliness which are less frequent, which is, for instance, this existential loneliness, which may be particularly relevant for older people, because it is strictly related to the sense of living in general. So it's a much deeper concept with respect to the other two that I mentioned before. Now, a natural question arises is, why should we care about loneliness? And this is a very important question. First of all, because loneliness is a serious public health issue, because as shown by the literature, it is associated with a wide range of health outcomes, of adverse health outcomes, both physical and mental health outcomes or emotional disorders. And as such, it also represents an economic problem, not only related to a higher healthcare expenditure, but also in the labor market, for instance, because it is associated with the increased absence from work, loss of productivity, and increased turnover due to lower job satisfaction. And there is also some literature showing that regions with higher prevalence of loneliness in the population, these regions are also less good in generating additional wealth. And loneliness, what is very important is that it is spread among different domains, and it is not a phenomenon that affects only old people, but it also significantly affects young people, as we will see in the second part of the presentation. And it can be related to a variety of social behaviors like social media use, civic behavior, individuals' preferences, and it also adversely affects several minority groups. For instance, LGBT community or immigrant population. And I will show you some very simple descriptives also for this latter aspect. Now, when we talk about loneliness and the measures that can be used to gather some information from individuals about this specific feeling, here we have some kind of a problem, because, as I said, loneliness is not an objective phenomenon, in the sense that it is different from social isolation. So it cannot be measured, for instance, by the size of the social network, the number of friends or close relatives, or the frequency of by which an individual sees or spend time with those people. Loneliness is a subjective feeling, and as such can only be collected by in surveys, by specific demand questions in surveys, and it is self-reported. And this is closely related to a series of problems. One of these is certainly the reporting bias or unwillingness to report loneliness, because very often loneliness is associated with social stigma. I will come to this point a bit later, which may lead individuals to underreport their true feeling if they're asked directly about how often they feel lonely, for instance. There may also be problems in understanding the concept, for instance, between different cultures, because what loneliness of being or feeling lonely means in one culture or language, it may have a different connotation in some other culture, and so on and so on, so forth. But when we talk about the measures of loneliness, we usually distinguish between the two main types of measures that are developed and used in the literature, and these are direct and indirect measures. The main difference between these two measures is it is evident also from the name of these two groups of measures, is that direct measures, they directly refer to loneliness or feeling lonely in the question. So they ask directly individuals, they're quite simple, and they ask directly individuals how frequently they feel lonely in a given time period preceding the survey. Indirect measures, on the other side, they do not explicitly use words loneliness or lonely, and they instead ask about different feelings or individual experiences that are closely related to loneliness. So, for instance, how often the individuals feel left out from the friend, or how often they feel they do not have a very close or good quality relations to count on, and so on and so forth. Together with these two broad measures, and I will say in a minute what are the main characteristics, structure, and advantages together with disadvantages of both, there are also some other measures of loneliness used in surveys, not many, they're less frequent. And here, for instance, we have the differential loneliness scale, social and emotional loneliness scales for adults. But these measures are much more complex because they have many more items. Okay, let's see the first category of measures, which are direct measures in surveys. So as I said, direct measures of loneliness, they explicitly refer to loneliness or being lonely in the question. And here you can see several examples, several surveys that use this direct measure of loneliness. In the European Social Survey, we have a direct measure of loneliness, a similar question also in SHARE for several waves, I think, if I'm not wrong, from wave 4 on. Then also in the EU SILC, we have this type of measure, European Quality of Life Survey as well, the Understanding Society, and the Generation and Gender Survey. And as you can see, all these type of questions, even though they may have a different response options, which are always categorical and refer to different frequencies, they all mention directly loneliness in their question. And then there are also some national surveys like German Socioeconomic Panel that use this type of measures. So this was an example of a direct measure of a loneliness in survey. Then we have indirect measures in survey. The indirect measure, they do not refer directly to loneliness or being lonely or feeling lonely, but they ask about experiences related to loneliness, as I said before. And the most well-known indirect scales used in the literature are the University of California, Los Angeles loneliness scale, the famous UCLA loneliness scale. And the second one is the De Jong loneliness scale, And they both exist in a long and a short version. But the short version is the one that is most commonly used. And then, as I said, there are some other loneliness scales that are less frequently used in the literature because they're much bigger. So, for instance, UCLA short scale, because the short version of the scale is most frequently used in the literature. But in general, this scale was developed in the late 70s and was including 20 questions capturing the frequency of different feelings, as we said before. Then at the more or less 20 years ago, 25 years ago, the short scale was proposed. In that scale, it just asks it is quite simple. It has 3 different questions, which ask how often the individual feel to lack companionship or feel left out or feel isolated from others. And then there are several answer options. In order to obtain a measure of the intensity of this feeling, then the options are translated in numbers. So if an individual answers hardly ever or never, it is assigned the score of 1. And if it assigns very often, then it is assigned the score of 3. Summing up all the scores among these 3 questions, we obtain an average score for UCLA scale, which can range from 3 to 9, where 3 indicates no loneliness and 9 indicates very lonely. And as I said, this short scale is the most commonly used scale in the literature. And we can find it in some large N surveys like SHARE, for instance. It is there. The second main scale that belongs to the category of indirect measures is the De Jong scale, and it was developed in the 80s. And the long version had 11 items, and now the short one has 6 different items. And as in the case of the UCLA scale, the words loneliness and feeling lonely are not directly mentioned. But this scale is quite particular because it has been designed to measure 2 different dimensions of loneliness. The one is emotional, and the other one is social. And these two dimensions are measured separately. So the short version of the scale, it has 3 positively worded questions that capture the social aspect of loneliness. And you can see, for instance, these are the last 3 here with S. This is the social dimension of the scale. And the other 3, which are negatively worded, that capture the emotional aspect of loneliness. So general sense of emptiness, missing having people around, or feel rejected, and so on. And originally, this scale was developed for older or adult individuals, and it is not used in many surveys. There are only a few studies, but we use it, for instance, in our EU loneliness studies. And then there are also other measures of loneliness, as I said, and there are also some measures that are used for a subsample of kids or children, and they're quite particular because these 2 that I showed you now are not very suited for kids because they're not easy to understand for them. But there are some specific scales that can be used for kids. Okay, as I said at the beginning, these 2 types of measures they have both advantages and disadvantages and weaknesses, of course. And for instance, direct measures, probably the biggest advantage of the direct measures of loneliness is the fact that they are simple and very concise. And they're really quite easy to implement in large N surveys. But this type of measures has also some serious negative aspects. As I said before, The understanding of loneliness as a term, as a concept, may differ across cultures, but the more serious aspect related to direct measures is the one related to social stigma, which may lead people to underreport their true feelings. And in addition, stigma, as shown by the literature, may be stronger for some subcategories of the population. For instance, men are more likely to underreport their true feelings of loneliness when asked directly about them with respect to women, due to this social stigma. And this can introduce a potential bias and lead us to a wrong conclusion about the prevalence of loneliness between men and women. Indirect measures, on the other hand, they cover a wider range of feelings that are closely related to loneliness. They do not have the problem that I mentioned related to direct measures of stigma, underreporting, because they do not refer directly to loneliness or being lonely. By construction, they're a bit closer to the researcher views and definitions of the phenomenon, but they're a bit less easy to implement, because they are not so simple as direct measure. They consist of more questions. So it is a bit more demanding to implement them in large N surveys. But despite this fact, they offer a more objective picture of loneliness, as they do not have so many problems with reporting bias as direct measures. So these were the main measures of loneliness usually used in the literature, in large N surveys, and hence in the literature. So to conclude, so what we know is that there is no universal agreement among researchers on which type of measure is the best one. Both have significant advantages and disadvantages. And so the best strategy for surveys would be to use multiple measures of loneliness. So both direct and indirect, and then compare the results. And there are relatively few studies comparing the results between different measures of loneliness. As I will show you later, these measures are also correlated quite well. So direct and indirect measures. And this also gives us the possibility, let's say, to treat also direct measures as valid measures of loneliness with caution, always taking into account what are the possible weaknesses of that kind of measures. And the last point, which is also very important, is related to the survey mode. Because the surveys can be conducted in different ways, and the way in which the survey is conducted may have an impact of how people interact with the survey and what kind of answer they give, or the degree of how true is their real feeling that they report. So as I said, the articles comparing the results between different measures, there are not many. There is one paper comparing the Young scale with in surveys conducted face-to-face and telephone surveys, and they found quite a similar results. But for the other scales, we do not have much evidence. Now, the EU Loneliness Survey, as I said, is the first EU-wide survey that measures loneliness at the European level. In that survey, we tried to overcome all possible weaknesses of the measures and take into account all the considerations that I mentioned before. So in this survey, we have both a direct question and two different loneliness scales, and it is the first EU-wide survey that is specifically designed to measure and monitor loneliness. We have more than 25,000 respondents from all EU 27 EU member states, and it was conducted in 2022. And it is unique for several reasons. First of all, because it includes a module on loneliness and social isolation with all the scales that main measures, both direct and indirect, that I mentioned. But it also asked about the individuals about their views of loneliness as a potential social problem, about the initiatives and the roles of different actors to address loneliness. We also have a module on social media. So how often the individuals use different types of social media, for what purpose, what are the negative aspects, whether they neglect work or family members for this. Then the individuals are also asked about their perceived trust, their preferences toward risk, and so on and so forth. So we have different modules, a lot of information, but it is focused on mostly on loneliness. As I said, we have two psychometric scales, so both UCLA and De Jong, and the direct question. What is also for a half, in order to avoid somehow influencing individuals' responses by the order of the questions by UCLA and De Jong scale, for instance, half of the sample were randomly assigned to a questionnaire where UCLA question came first, and the other half to another questionnaire where the Jong scale came first. So when the UCLA came first, then there was a battery of unrelated questions in between, and then the Jong scale was asked. Okay, and then for some subgroups of individuals, for instance, for employed people or the individuals, those that are still in education, we also asked about their feelings of isolation at work or at school, if they're still in education, whether they lack support from their colleagues or management or classmates or teachers, whether they're in school and so on. Now, since loneliness, as I said before, is not the same as social isolation or connectedness, these two are not the same concept, we also added some questions about individuals' networks. So, for instance, we ask individuals about the frequency of contacts with their family members or friends, in a different way, or in person, or via social media, or phone, or internet. Then we also ask them about the number of close friends and family members. Those in a relationship, we also ask them about the quality of the relationship with the partner, or also in general, the frequency of contacts with neighbors. We also collect information on different life events that individuals could experience during their life course, such as the separation from the partner, the loss of partner, loss of close family member, loss of employment, conflict in the workplace as well. And together with this, of course, we collect all standard socio-demographic characteristics. So together with the module on socio-demographic characteristics and loneliness, we have 5 other modules, which in total is 7 in the survey. We also have a module on childhood experiences, in which we collected information about adverse childhood experiences of individuals, so during their childhood, which are related to the quality of the relationship with parents, possible presence of physical abuse, but also we have the frequency of loneliness feelings in childhood, then the number of friends in childhood. No, we have the number of friends in childhood, yes. Then we also have a health and module, in which we collect information on individual health status, current health status, both physical and mental, and health-related habits, so smoking, drinking, eating foods, dietary habits. And we also ask about the individual's health status in childhood. okay? Then the module on social media use, ask individuals on the type of social media that they're using, how frequently they use these media, so how much time per day they spend in, for instance, messaging tools or other social network sites like Facebook and others. Then we also have a module on civil society and trust, and attitudes toward others and also government, in which individuals are asked about their trust in other people, about their voting behavior, frequency of cultural attendance, volunteering, and several other social activities. And finally, there is also a module on interventions, which I mentioned a couple of minutes ago, which collects information about individual opinion, about interventions and actions taken to fight on loneliness and on the importance of loneliness in general, or all the initiatives aimed at reducing this negative feeling. So in total, we have 7 different modules. Let me tell something about the survey methodology. So we have 2 distinct samples. One is from the consumer panel, and this is the one that is related to 27 European countries. And we have another sample, which is taken from a probability-based panel, and it refers only to 4 countries. As for the EU 27 countries, sample, we have more than 25,000 respondents. In this sample, to achieve a sample that is possibly representative of the population of each member state, quotas were used for sample selection. So these quotas reflected the target population in terms of age, education, gender, and the geographical collocation, so NatCen region of residence. On the other side, the probability-based sample is only for 4 countries, so Sweden, Italy, Poland, and France, reflecting, so 1 country from each macro geographical region in Europe. And it was a shorter questionnaire in this case. And in that case, there was a small share of individuals which did not have the access to digital tools. So for them, this survey was conducted by phone. And it had some consequences. I will mention it later. So as I said, different loneliness measures are also correlated quite well. So here you can see the correlation coefficients between the direct question and different loneliness scales. For direct question, we distinguish between very lonely and slightly lonely. Very lonely in a direct question are those individuals who declare to feel lonely most of the time. In, for instance, UCLA scale, very lonely are those who score 8 or more. Slightly lonely are those who feel lonely some of the time, or in UCLA terms, those with a score that score 6 or higher. If we compare the share of individuals feeling very lonely or slightly lonely in Europe, we can see that for all the measures, so both direct and the indirect scales, the frequency of experiencing loneliness is quite similar. It is between 12 and 13% for very lonely individuals, and those feeling slightly lonely is between 36 and 40, depending on the different scale used. But when we compared, for instance, individuals feeling lonely between 2 different data sets, so the one based on 27 countries and the probability-based, the one related to the 4 countries in Europe, we can see significant differences in the share of people experiencing loneliness. One reason for this can be, and this, of course, this calls for caution in the generalization of the results. Now, the differences in this result may be due to the sampling design and the possibility that I mentioned before, that part of the individuals, even though not very large, in the probability-based sample did not have digital tools, so they were asked by phone, they were surveyed by phone, and mostly they were older people, which can have a lower attitude toward expressing their true feeling of loneliness. So this one can be one of the reasons why we observe such a different incidence of prevalence of loneliness between the two samples. Okay, let me show you some interesting correlates of loneliness that comes from our data and that we collected in a series of policy briefs, technical reports, and articles. For instance, here you can see the prevalence of loneliness by different income class or educational level or employment status or by age. So we can see that generally loneliness is higher for less wealthier individuals or those that have a lower educational level. It is particularly pronounced for individuals, for unemployed individuals, compared to to those employed or still in education. And interestingly, the last panel here shows the probability of experiencing loneliness by age for males and females. While there is no significant difference in between males and females, we can see that loneliness is considerably high among young individuals, and then it decreases across age. Here I cut at 70, at the age of 70, but if you consider individuals older than 70 years old, you can see a slight increase in loneliness. But however, here we can see that the incidence of loneliness among young people is considerably high, and this is something that quite serious, right? Then loneliness is also adversely affects some minority groups. So here we can see that first and second generation migrants have a higher prevalence of loneliness with respect to native individuals, especially second generation migrants. And here, which I not showed in this slide, there is some difference between emotional and social loneliness as measured by the De Jong scale when we talk about immigrant population. Then loneliness is also significantly higher for LGBT individuals compared to their heterosexual peers. And for instance, as for the LGBT individuals, they are 6 percentage points more likely to experience loneliness. And gay men are more likely to experience loneliness, for instance, than a lesbian woman. And the prevalence is highest for bisexual individuals, which is one interesting finding. If you're interested in these arguments, you can find some additional findings in this paper here on the health and relationship quality of LGBT individuals. Then loneliness is also related to some life events, as I said, so positively correlated with separation from spouse or severe conflicts at home, or with the health status of individuals. So having some severe illness or injury, which is quite logical, but also with the loss of employment or severe conflicts at work. Then here, we can see that loneliness is also related to adverse childhood experiences. So individuals that experienced a low quality relationship with parents, or that had that were lonely in childhood, or that they shared the household and lived with close relatives affected by mental problems or drinking problems, they are significantly more likely to report feelings of loneliness today, after controlling for all demographic and socioeconomic characteristics. And then also loneliness is related to the number and of social relationships, connections, and the frequency of contacts with friends. Yes, so these are the main, let's say, correlates of loneliness. But loneliness at the same time is also related to several other outcomes like health, social media use, or civic behavior. For instance, here in this graph, you can see that loneliness is that individuals spending more than 2 hours on social networks like Instagram, TikTok, Facebook, they are significantly more likely to experience loneliness. And of course, this likelihood is higher for younger individuals than for older ones, so older than 30 years old. While there is no significant effect, for instance, of spending more than 2 hours on instant messaging tools, which you can see in this part of the graph. Then loneliness is also positively or negatively related to individuals' health. Individuals experiencing loneliness are much more likely to report poor overall health or feelings of depression. And so the difference between lonely and non-lonely individuals in the case of depression is really high. Here you can see the percent of respondents with depressing feelings for lonely subset of individuals and non-lonely subset of individuals. And you can see here that lonely individuals are significantly they're more likely to report depressive feelings with respect to non-lonely ones. And this is more or less stable across age. And here, here we can see the percent of respondents with adverse general health or long-lasting physical health conditions for lonely and non-lonely, a subset of individuals, and the conclusions are more or less the same. Similar for unhealthy behavior, smoking, drinking, or unhealthy dietary habits. Okay, so a low quantity of fruits or vegetables in the individual's diet. All these were very simple descriptives, let's say, on the correlates of loneliness and the potential correlations between loneliness and several other outcomes. But when it comes to the empirical analysis, isolating the direct effect of loneliness on several other issues is a very complicated thing, because loneliness is endogenous and there is always the problem of reverse causality. And now, one of the ways, of course, to deal with the problem of endogeneity is to having longer panel studies, but this also would not solve the problem at 100%. Another possibility is to find some exogenous proxies for loneliness. And this is something that we tried to do in one of the papers that we wrote at the JRC, which was about the cultural roots of loneliness and historical roots of loneliness. And we used several cultural characteristics, a specific cultural threat related to the individual's parents, so considering second-generation migrants, in order to instrument the probability of experiencing loneliness today. And this cultural threat, I will be very brief, this cultural threat is related to, it is called restraint, it is taken from Hofstede, and this cultural characteristics is strictly closely related to the importance of norms and prohibitions in the society. And so what we showed here is that individuals with cultural backgrounds that are characterized by more stringent rules of conduct, so conduct of behavior, and stronger social norms in general, they are on average more likely to experience loneliness compared to the individuals coming from less restrictive societies. This is because social norms and prohibitions have been shown to significantly influence the perception of quality of social relationships. And as I said at the beginning, quality is the main component of loneliness. So it's much more important than quantity. So what we did, we then used this specific historical cultural dimension to instrument loneliness. And we showed that, as I said, that individuals with these specific restraint backgrounds are significantly more likely to experience loneliness, while other characteristics related to the size of the social network, which is, for instance, the individualism, are not. And then we used it in order to quantify the direct effect of loneliness on health. As you can see here, these are the coefficients of the second stage of our instrumental variable approach. And we show that loneliness has a direct impact only on some health outcomes, particularly on BMI and on some aspects of emotional disorders. And then indirectly, it may be related also to some other physical issues, but that is the direct effect. And I will conclude here in 10 seconds. So if you are interested, you can visit our webpage. You can find the QR code in one of the first slides that I showed you. We have several deliverables, policy briefs, technical reports, repository of loneliness interventions, and there is also a book forthcoming about loneliness in Europe. So this is all for me. Thank you very much. I hope that I'm in time, more or less.
Thank you, Matija. Fantastic presentation. Really, really interesting. We have some questions for you already. The first came at the very beginning, but I guess it's really about what this means, and it's about how will we have wonderful tools of social lives in order to get rid of loneliness in Europe. So I guess what are the policy implications of your research?
Yes, there were several initiatives at the European level to address loneliness, and at the European level, not so many as at the national level. So the case studies. But for instance, let me check here. Yes, there are some initiatives. For instance, one is called the Healthy Loneliness Project in Europe. That was an initiative that introduced a new educational program to create an enabling environment to minimize the negative effect of loneliness, for instance, especially for older people. Then there was another project, it is called the Alone Project, that is offering trainings in the healthcare system that facilitates the approach of vulnerable groups, especially older people, which may suffer especially from this existential loneliness. Then there is another initiative related to culture and arts, and it is called, I don't remember exactly the name, however, how loneliness can be alleviated by participating in different cultural and artistic activities and so on and so forth.
Fantastic, thank you. Next, I'll take two questions next together. First, is it possible for people outside of the Commission to access the data from the survey? And also, is it possible to link this data with data from other surveys like ESS or SHARE?
The data will be available immediately after the launch of the book. That will be mid-November. So in 1 month, all the data will be available for the research community. So they could be used without any restriction. So we are just waiting the launch of the book, and then we will make them available. As for the link with the other data sets, I'm afraid to say that it is not possible, but if some colleagues of mine find that I'm wrong, so please correct me. But I think that this will not be possible, unfortunately.
Just to say, not specifically on this topic, but in another project that we're running at the moment with GGP and EVS, we are looking at the possibility of harmonizing data from cross-national surveys on similar topics. So maybe there will be some learning from that we can share. And of course, JRC are collaborating with us in that project. Another question now, did you ask anything about household composition or anything about connectivity to the local environment, i.e. how easy it is for them to meet other people face to face?
Yes. The household composition, yes, we have the standard questions on household composition. So the marital status, the number of kids, yes, and the standard thing. Then about, what was the second part of?
How easy is it for the respondents that you spoke to, for them to meet other people face to face? Did you have anything in there?
No, exactly. We have something in the social media module. Among the reasons why they use social media, one of the options is I'm using more social media because it facilitates the meeting with people, the interaction with people compared to physical contact. We have that.
Great. Question from my side. I'm going to interject one now. I had an interest in the difference between the probability and non-probability samples. And one explanation you mentioned might be the inclusion of the elderly and the telephone survey. I wondered if another possibility might be that those that sign up for these online commercial panels might be people who are online more anyway. I think that's often how they're recruited. And therefore, it might overrepresent people, I guess, who are predisposed to be lonely because you found this relationship with being online and loneliness. Do you know much about how the people were recruited to these panels?
I'm not really an expert in this aspect, but I don't know the exact answer to give you. But if some of my colleagues maybe have something to say on this regard, because I remember that there were discussion about the reasons underlying the difference. So I would just, if it is possible, to ask some of them if they have something to say, just to jump in to complement this.
If they're able to raise their hand, that may be possible. I don't know. Stefan, my communications person, will probably know better, but I'm not sure if it's possible. Or they can also comment in the chat.
Or in chat, yes.
Yeah. So maybe we'll leave that for a moment. Maybe they can comment there, and we'll come. Oh, actually,
Francesco, yes.
Let's see if this will work.
Francesco is our expert for that.
I think that would work now, Francesco, if you're able to unmute yourself.
Sorry, I have some issue with the camera. I don't know what's happening, but let me say, so yes, it is an issue, Rory. So basically, we know that this sample, of course, might be not representative, and yeah, we've seen that these people that are in the commercial panels that are more likely to be online compared to those in the probability-based survey, for instance. And yeah, we're trying to kind of take into account this, of course. In this data, and just the first simple answer is that probably not the best data to look at the shares of loneliness in Europe, because there might be some issues, but the data is very good, I think, still to check and control, to look at associations between variables and
absolutely the interrelationships.
Yes, and about so how the people came into the panel. Sorry, we don't know, unfortunately, that well. So basically, it's these are different commercial panels, and we don't know exactly. Maybe sometimes even through social media, but we don't know exactly, unfortunately.
Okay, thank you very much. That's really, really helpful and interesting. A couple more questions. One person asked, can we have access to the PowerPoint? This will all be posted on our YouTube channel a few days afterwards, and we'll send a link to those of you that came, so you'll be able to access that. Another question, do you know if EU loneliness survey also includes individuals living in long-term care facilities? And this could increase the prevalence of severe loneliness, for example, in the older population. No. I assume in general it probably doesn't, but
no, it doesn't. No, it doesn't. Yeah.
Yeah, they're often excluded, actually, people in care facilities from most household surveys. So it's not only this one, but others. So that would maybe need a specialist survey in those facilities. Did you also ask about well-being? And if so, was there any relationship between loneliness and well-being?
Well-being, we asked about the economic well-being, so income. There is also life satisfaction, and of course that there is an inverse relationship between life satisfaction and loneliness, and also with income, as I showed you. So it is decreasing with income. Yeah.
Great. Lots more questions, lots and lots of interest. Did you ask any questions about housing tenure, e.g. renters? And if so, were there any big differences?
If I'm not wrong, yes, we have the type of dwelling, whether the individuals rent or not, but I'm not 100% sure. I really apologize. I really don't remember that.
Is the questionnaire available on your website? Are people able to see that, or will that be after the book?
I think that it is still not available, but it will be after the launch of when the data will publicly available. Yeah.
Lovely, thank you. Someone has seen in the presentation that you can identify people with disabilities. Is that correct? And how was that measured?
with disabilities. We have several questions. We have some questions about long-term limitations. Yes, but I don't remember what disability I showed you. Referring directly to disability, I was referring to some minority groups like immigrants and LGBT, but disability, explicitly disability not, but we can have an idea about how many physical limitations individuals have. Yes, we can have. Due to long-standing health issues.
Long-standing health issues rather than
Yeah.
something more nuanced. Yeah, that's the usual question, isn't it? Do you think there could have been any framing effects by having a questionnaire or a module solely focused on or mainly focused on loneliness?
Yes, but yes, yes and no. But the order of questions that I mentioned before, and also the different types of scales that are mentioning loneliness, not mentioning loneliness, may alleviate part of this problem, I think.
Thank you. One of your colleagues has put in the Q&A actually now a link. You can request the questionnaire by writing to
Okay.
mailbox.
Perfect.
Thank you very
Perfect.
much, Elizabeth.
Elizabeth, thanks.
You had questions, didn't you, on use of the internet and online tools? That was included. Yeah, that one we've done. Next step for the data and findings. I think you've mentioned that there's the book launch and then the data.
Yeah.
Are there ever any plans to repeat the survey?
For now, not. For now, not. But it would be really needed to have or a repeated cross-section, especially panel, in order to improve the monitoring, the process of loneliness. So this is one of the things we will see. For now, nothing very
nothing immediate.
Immediate.
And one last question: what statistical analysis are typically used with these two main loneliness scales, with loneliness as the outcome?
The problem of this, most of the literature, but really most of the literature, not only in economics, they're mostly in epidemiological science and clinical science, psychology, sociology. They're based on associations, because it's very hard to deal with the problem of endogeneity and reverse causality. And so, of course, when interpreting the results, we need a lot of caution in doing that, because these are correlations, not the real direct effects. There are some papers using the longitudinal panel of component of surveys, like, if I'm not wrong, the Journal Socioeconomic Panel. This alleviates in part the problem of endogeneity, or some attempts like the one that I shortly presented in searching of exogenous proxies for loneliness, but it's just quite hard. Yeah. And also experiments that could be done. And we also have an experimental, a very simple trust game in the surveys that can help you to isolate the direct effect of loneliness. Yes, definitely.
Oh, that sounds really interesting. Is that shown in the questionnaire?
Yes, yes, it is. Yes, yes, it will be there. Yeah.
Yeah. Fantastic. Thank you so much for the presentation today.
Thank you very much.
Lots of interest, but lots of attendees, almost 100 at the.
Oh, that's great.
Presenting. So that was
great.
Excellent. Lots of interest. Thank you to everyone who's joined us today. Our next presentation will be on the 20th of November, again at lunchtime, 1 to 2 UK time. That will be Innovation, Engagement and Inclusivity, a feasibility study for a new UK birth cohort by Professor Lisa Calderwood at UCL. And then on the 12th of December, there will be a presentation on cognitive testing of the new WHO questions on sexual and reproductive health by Erin Hunter at Clemson University. So do sign up for those if you're interested. Thanks again to Matija for the wonderful presentation. We will put this up on our YouTube channel within a few days. And thank you everyone for joining us, and have a lovely day.
Thank you very much for inviting.